We have been talking all month long about heart health, what it takes to keep your heart healthy, signs and symptoms of a heart attack and stroke, why high blood pressure is now called the silent killer, and the importance of heart health specifically in women. One person dies every 37 seconds from heart disease in our country, and it's the leading cause of death in women in the United States. So today we are focusing on something called aortic valve disease. That's when the valve between the main pumping chamber of your heart and the main artery to your body just don't work properly. To say it in layman's terms, I guess, Dr. Ajay Eskol, a board-certified interventional cardiologist at Midwest Heart and Vascular Institute at HCA Midwest Health, is here with us now to tell us a little bit more about this aortic heart disease. And is it something we need to really watch out for?
Yeah, so aortic valve disease is quite common. About 1 in 8 of people who are over 75 suffer from this. And you can think of it as the gateway to the body. The heart is pumping blood with every heartbeat to the whole body, and there's a one-way door that lets blood out and prevents it from coming back in. And if you have problems with this door, this valve, then it can really affect how you feel every day, and it can actually shorten your life.
Okay, so let's talk about how that feels. What are the signs and symptoms if that door isn't working properly?
So the valve disease occurs very slowly over time. So sometimes the symptoms are not that obvious, and the first sign might be that your doctor says you have a heart murmur. The other symptoms could be that you're losing energy, getting short of breath when you're active or when you lay down at night. You could have swelling in the legs. And sometimes people have chest pain, chest pressure, or fainting spells.
So a little more common symptoms that we naturally think about.
Right.
But what happens? Does that door just kind of slowly over time lets a little bit in, lets less in, and just kind of
So
peters out?
It's a wear and tear problem, and the door slowly gets stiffer and opens less wide. And so the heart has a harder time pumping blood through.
Okay, so hopefully if we're alert enough to recognize those symptoms and we come in, what can be done about it? Anything?
So we live in an exciting time. There's lots of minimally invasive options now to treat aortic valve disease, but the traditional approach is open heart surgery, where we have to replace the heart valve. And that's still the right option for many people, particularly younger patients.
Okay, but you say this is an exciting time. Why do you say that?
So we now have new surgical approaches where they can replace the valve through a smaller incision on the chest with less recovery time. And also we have transcatheter aortic valve replacement, which is replacing the heart valve through the leg artery. And we use a long tube that's about the size of your finger, and we can replace the valve through that tube. And then people go home the next day most often.
Wow. So a big difference from the big incision we're used to seeing, I guess in the movies more so, of open heart surgery.
Yeah, it's a great advancement in our field.
Is that for everyone with this, or is that only open to certain patients for some reason?
So we've had multiple studies recently come out saying that almost anyone who has aortic valve disease should be considered for this procedure. It used to be it was only offered for patients who were high risk for surgical valve replacement. But now we are considering it for almost everyone, and it's a patient individualized decision, but it's not necessarily just for high risk patients anymore.
Just curious, when you actually go in there, are you actually replacing that door?
That's a very good question, Carolyn. Basically, the valve comes up through the tube, and then we push the old valve into the corners. So there's
you don't remove it.
We don't remove it.
Okay.
It serves as the anchor for the new valve.
Oh, very interesting. Oh, I find this fascinating. But obviously, if you're having these symptoms, don't question it. Figure out what the problem is, and this could be it.
Right.
Yeah, doctor, thank you so much
for
stopping by this afternoon. For more from HCA Midwest Health, go to kctv5.com/HCA Midwest.